WHO surgical safety checklist, for example, from England and Wales. Number one, when you enter to any website, you sign in to be read aloud. Then you agree for terms and conditions of use. So this is a time out. And number three, you sign out. In every step of those, there is a SPAR tool, identity of the patient and doctor and anesthetist and everybody rule and nursing staff, circulating and scrub nurse and pedia nurse and pedia doctor or neonatologist. And there is a SPAR tool again in time out, agree for terms of use and conditions. And lastly, SPAR again for all staff and patient. And the procedure to be done, for the procedure to be done, need to review the consent of the patient. We can go alphabetical, it will be easier. Alphabetical, there is three A's for anesthesia. There is risk of aspiration and MPO, and the last meal taken and complex carbohydrate diet before the surgery for enhanced recovery program, maybe 1 hour or more according to the number of hours for fasting per anesthetist. If there is regional anesthesia or general anesthesia, risk of airway and aspiration, and the allergy to any anesthetic or any other medication can be pre-medicated for anesthesia or given during anesthesia or after recovery. Can be also added prophylactic antibiotic. Number B, blood and blood units. B and P. P of pen for pediatrics, risk of general anesthesia, risk factors in mom and baby, the analgesia if opiate like diamorphine or pethidine that lead to hypoactive baby needs neonatal resuscitation, and the blood bank, blood group, and the number of blood units. If there is blood transfusion, an amount of blood loss and estimated blood loss, so this is BP. And number three is the catheter and consent, 2 C's, 3 A's, 2 B's, and 2 C's. Time out. You repeat the SPAR for every staff and its rule and his or her role in the theater. Again, we review the 3 A's, we review the 2 B's, we review the amount of blood loss per cesarean usually averages 500 and not more than 1,000 milliliters. And 2 C is the catheter and consent again. And the nominate the surgery and any step that expected to be difficult in the surgery. C is catheter draining urine and kept. And D letter is the venous thromboprophylaxis, and this is checked by the circulating nurse that there's pneumatic compression device or heparin, and the plan of giving heparin or held before delivery by 6 or 12 hours for prophylactic and therapeutic Clexane respectively, and given after surgery by 6 and 12 hours as well. Sorry, before surgery 12 and 24 hour respectively. Then sign out. We go out of the theater, we go out of the website, we'll endorse it to another inpatient ward, setting a plan for enhanced recovery program. There is a SPAR tool, number of there is any aspiration, any allergy happened, any airway concern happened during surgery and during recovery, and 2 B's, how amount of blood loss, estimated blood loss, 300 milliliter, 500 milliliter, 1,500 milliliter, or else. Others also can be reviewed, like P, pediatric has any concern about the baby, will be given to mother and mother condition allows or not, the mobilization of patient after surgery and removal of catheter for enhanced recovery program, and the plan for fluids and analgesia, also for motility of the patient after surgery, enhanced recovery program, and the plan of CBC and the report of surgery. And C, the catheter urine is clear and adequate urination collected in the bag, and the sign out of surgeon may be needed in some theaters manually, and there is other steps like the plan for venous thromboprophylaxis like Clexane or heparin or enoxaparin according to the weight of patient, and the future plan if there is risk of hemorrhage or any contraindication to thromboprophylaxis should be discussed with team debriefing, what went good, what went bad, what went hard, and then incidents report of a reportable incident happened. Thank you very much.